wanted to talk about Arthrogryposis Awareness Day, which is coming up on June 30th. That day, everybody should wear blue to support people like me with arthrogryposis. Why you should care about Arthrogryposis Awareness Day is basically because very few people understand what it's about. Arthrogryposis is a congenital condition that happens 1 in every 3,000 live births. A congenital condition is not a disease. A disease is something that you can catch. You're not going to catch arthrogryposis by coming into contact with one of us. And the word arthrogryposis means curved or hooked joints. And one of the biggest characteristics of the disability is hands or feet that are hooked in a permanent position. And this is because there is a fibrous overgrowth of tissue that forms over the joint in the womb. And it can also happen as tendons and ligaments don't stretch enough in the womb, and that will pull down the hand or the foot into a hooked position. Once that happens, movement in the womb is restricted, and the child who will be born will have muscle atrophy, nervous system conditions, sometimes paralysis of certain limbs, and various other things like that. Arthrogryposis is a umbrella word for about, I think it's about 250 different conditions, and they're all related by either feet or hands being affected by the hooked joints. And when that happens, to be diagnosed with arthrogryposis, you have to have somewhere around, I believe it's at least 2 limbs affected. In my case, I have a fairly rare form of it because all 4 of my limbs are affected. I'm technically a quadriplegic, which is not the same as someone with a spinal cord injury because I can feel everything in my body. My spinal cord is not injured. I have other complications with arthrogryposis, like scoliosis, which is when your spine curves. I also have club feet. I have hip dysplasia, which basically looks on an x-ray like your hip is permanently dislocated. And I have some other complications that go along with arthrogryposis. So the base condition is arthrogryposis, but the people who have the condition will have a lot of other complications that go along with it because we can't move around as much as everybody else. It's important to note that treatment for arthrogryposis is most effective in patients who are children. Once you get to be the age where all of your bones have fully formed and fused, then it's almost impossible to do surgeries that will have any kind of lasting impact on the body. Surgical intervention involves orthopedic stuff, putting bones in different positions, sometimes cutting bones, breaking bones, and fusing them in the right way. And the most serious surgery most of us have to go through is a spinal fusion, which is when they wire titanium rods to our spines to straighten them out. And that can be a partial fusion or it can be a full fusion. I'm one of the people who has a full fusion, which goes from my neck to my tailbone, and the 2 rods spread out across my pelvis. So I can't bend at the waist like everybody else does. Most of us will have at least half a dozen surgeries, and the more severe your form of arthrogryposis is, the more surgery you'll have. I've had, I believe it's 19 surgeries now, something like that. And when I was a child, it used to be 2 surgeries a year. And as I got older and my body stopped growing and stuff, then it became fewer and fewer. And my last major surgery was in 2002. The life expectancy for a person with arthrogryposis is normal for the most part. Some forms of arthrogryposis are very severe, and I've I think sometimes that can affect the life expectancy. Plenty of women with arthrogryposis can give birth to healthy babies. Naturally, it wouldn't be vaginal births because of how tight our bodies are, but we can carry to term. I know a lot of women with arthrogryposis that have had babies. In my case, because mine is so severe, about half the doctors say I should, and half of them say I shouldn't. So it's probably really going to be up to me if I'm comfortable taking that risk. There are some forms of arthrogryposis that they think might be genetic. I don't know exactly what kind I have because there are so many, but other members of my family have bone issues and things that resemble arthrogryposis. So I don't know if mine is the genetic kind or if they've even proven that it is genetic in some ways, but there are a lot of unanswered questions, and that's why days like Arthrogryposis Awareness Day are important, because there are so many unanswered questions. So on June 30th, it would be really wonderful if everybody could wear blue for us and post your pictures on social media with the hashtag blue for AMC. Thank you for watching!